Most of us are taught to believe that if a doctor writes a prescription, or if a pill is sold over the counter at the local pharmacy, it is perfectly safe. We assume that because it went through regulatory checks, it cannot harm us. I used to look at things the exact same way. But over my 20 years as a chest and heart surgeon, my perspective completely changed. I started seeing a troubling pattern on my operating table. I would treat patients in their 60s, 70s, and 80s for sudden heart attacks, unexpected strokes, or acute cardiac arrest. These were good, responsible people who did everything right. They took their pills every morning, followed the instructions perfectly, and trusted the system. Yet when we looked at their daily pill organizers, the exact same medications kept appearing. My name is Dr. David Mitchell. I am a cardiothoracic surgeon, and I have spent over 2 decades operating on hearts that did not have to fail. Today, I want to talk to you calmly and directly about 5 very common medications that can dramatically increase the risk of heart attacks and strokes in older adults. This is not about causing fear. This is about giving you the clear, simple information that a busy doctor may not have the time to explain to you during a brief office visit. To understand why common pills can become hazardous as we age, we have to look at how drugs are developed. When a new medication is tested, it is usually trialed on younger adults in their 20s, 30s, and 40s. These test subjects are typically healthy, have only one medical condition, take no other pills, and possess a young liver and kidneys that process everything perfectly. But an aging body handles medication entirely differently. By the time you reach your 60s or 70s, your kidneys filter waste more slowly, and your liver breaks down chemicals at a fraction of the speed it used to. A dose that a 40-year-old can process without a single issue can linger in an older body for too long, accidentally putting a massive strain on the heart. Furthermore, the average senior takes 4 to 5 different prescription medications every day, and many take 8 or more. They take them for completely valid reasons: high blood pressure, arthritis, diabetes, or sleep issues. But here is the uncomfortable truth. Those drugs were almost never tested together in combination within an aging body. The way they interact inside you can be highly unpredictable. The medical system was simply not designed with the complexities of an older body in mind. That gap between a drug being prescribed correctly and it being safe for you specifically is exactly where cardiac emergencies hide. Let's look at the first category: common over-the-counter painkillers known as NSAIDs, which include ibuprofen, naproxen, and diclofenac. Because you can buy these at any grocery store or pharmacy without a prescription, most people assume they are as harmless as water. When your knees ache or your lower back hurts, reaching for an ibuprofen feels like the natural thing to do. But inside an older body, these drugs cause the kidneys to hold onto sodium and water. This immediately raises your blood pressure. For an older heart that is already working hard, elevated blood pressure is like adding heavy cargo to an engine that is already running hot. On top of that, these painkillers interfere with the protective lining of your blood vessels and make your blood platelets stickier. This makes the blood much more likely to clump together and form a dangerous clot. A clot in a heart artery causes a heart attack. A clot in a brain artery causes a stroke. Medical data shows that regular use of these common painkillers in people over 65 increases the risk of a heart attack by up to 30%. If you are dealing with chronic pain, please talk to your healthcare team about gentler alternatives such as acetaminophen, topical pain relief creams, targeted physical therapy, or simple lifestyle adjustments. Managing your pain does not have to come at the expense of your heart. The second group consists of an older class of diabetes medications called sulfonylureas, which include drugs like glibenclamide, glipizide, and glimepiride. These medications help control blood sugar by forcing your pancreas to produce more insulin. While that sounds helpful, these older drugs force insulin production regardless of whether your blood sugar is currently high or low. As a result, they can accidentally push your blood sugar down to dangerously low levels, a condition called hypoglycemia. In a young person, low blood sugar makes them feel shaky, sweaty, or dizzy. They eat a piece of fruit, and the feeling passes. But in an older adult, sudden low blood sugar can destabilize the heart's electrical rhythm, triggering a dangerous arrhythmia. In a vulnerable heart, an irregular rhythm can quickly spiral into a crisis. Making matters worse, the natural warning signs of low blood sugar often fade as we age. Many older adults walk around with dangerously low glucose levels without feeling dizzy or shaky at all, meaning their heart is paying a heavy price in total silence. If you or a loved one takes medication for diabetes, ask your doctor about your specific risk for low blood sugar. Modern choices, such as SGLT2 inhibitors, control blood sugar safely without causing sudden drops, and they actually provide proven protective benefits for your cardiovascular system. The third category involves certain medications used to treat depression and nerve pain, specifically an older group called tricyclic antidepressants, which includes amitriptyline, nortriptyline, and doxepin. Depression in older adults is a serious matter, and the right treatment can genuinely transform a person's quality of life. But these specific older medications have a well-documented side effect. They interfere with the delicate electrical system that regulates your heartbeat. In a young heart, the body easily compensates for this interference. But in an older heart, it can cause a disruption in the electrical rhythm known as QT prolongation. This disruption can trigger a sudden, life-threatening, irregular heartbeat that can cause the heart to stop completely. Even some newer common antidepressants can impact heart rhythms if taken in higher doses. Please do not stop taking any prescribed antidepressant on your own, as doing so can be highly dangerous. Instead, simply ask your doctor for a baseline ECG. This is a simple, painless 5-minute heart tracing that will show exactly how your heart's electrical system is handling your medication. The fourth group involves everyday allergy pills and over-the-counter sleep aids that contain an ingredient called diphenhydramine. This is the active ingredient found in standard Benadryl and many nighttime PM pain relievers. Because these allergy pills have been on pharmacy shelves for generations, people assume they are entirely safe. However, diphenhydramine blocks a vital chemical messenger in the body that helps regulate your heart rate. In older adults, this can cause a sudden, racing heartbeat or a severe irregular rhythm, particularly at night when the body is resting. Seniors frequently reach for these pills simply because they are having trouble sleeping, unaware that the medication is actively stressing the very organ they are trying to rest. The good news is that newer second-generation allergy medications, such as loratadine or cetirizine, provide excellent allergy relief without crossing into the heart's electrical system. Making that simple switch can completely eliminate an unnecessary risk to your heart. The fifth category covers over-the-counter cold and sinus medications that contain decongestants like pseudoephedrine or phenylephrine. These are found in many common multi-symptom cold and flu liquids and sinus pills. When you have a severely stuffed nose, these medications work beautifully by narrowing the blood vessels in your nasal passages to reduce swelling. The catch is that they do not just narrow the blood vessels in your nose. They constrict blood vessels throughout your entire body, including the delicate arteries that supply blood directly to your heart. If an older adult already has narrowed arteries or high blood pressure, these decongestants can cause a sudden massive spike in blood pressure. This sudden pressure strains the heart wall and can trigger a severe chest pain attack or even a full heart attack. I have had patients end up in emergency surgery simply because they took a strong decongestant to treat a bad winter cold. If you have a history of high blood pressure or heart disease, please read cold medicine labels carefully. Simple saline nasal sprays, humidifiers, or steam inhalation can clear your congestion perfectly without affecting your blood pressure or your heart. Now let's look at the most critical issue. What happens when a person takes 2 or 3 of these common pills at the same time? In medicine, this is known as polypharmacy, and it is one of the most dangerous silent issues affecting older adults today. Imagine a normal scenario. An 70-year-old woman takes a common painkiller for her morning arthritis, a daily antidepressant for her mood, and an over-the-counter allergy pill at night to help her sleep. Each pill was chosen for a completely sensible reason. But look at what is happening inside her body simultaneously. The painkiller is raising her blood pressure. The antidepressant is altering her heart's electrical rhythm. And the allergy pill is destabilizing that rhythm further while accelerating her nighttime heart rate. Her heart is facing a combined physical stress from 3 different directions at once. And yet, because each pill came from a different shelf, no one connected the dots. I see variations of this exact situation in the hospital every single week. These medication interactions are subtle, and even busy doctors can easily miss them during a quick checkup. This is why having a formal medication review is one of the most protective things you can do for your health. Please do not feel overwhelmed or frightened by this information. You are far from helpless. And there are 4 simple, concrete steps you can take starting today to protect yourself. First, create a single master medication list. Write down every single prescription pill, over-the-counter medicine, vitamin, and herbal supplement you take. Keep this document with you at all times. Second, request a formal medication review. You can bring your master list to your local pharmacist. Pharmacists are medication experts, and they will happily look over everything you take to check for dangerous combinations completely free of charge. Third, the next time you visit your doctor, start an open conversation. Use these exact words. I want to review my list to make sure all my current medications are still the safest choices for my age and my heart. A dedicated, caring physician will always welcome that question. Fourth, remember to never stop taking a prescribed medication suddenly on your own. Any changes must be made carefully under direct medical supervision. I have spent my entire professional life working in operating rooms. I have held beating human hearts in my hands, repaired delicate arteries, and stood under surgical lights at 3 a.m. trying to save patients who had no idea they were even in danger. The reality that stays with me is that most of the cardiac emergencies I treat in older adults are completely preventable. They were not bound to happen. They occurred because of a simple gap between what was prescribed and what was actually safe for that specific individual at their specific stage of life. Most of these patients weren't being reckless. They were just following old routines without the updated information they needed. That gap is exactly why I share these insights. An informed patient is a protected patient. Your heart has been working for you every single second of your life, beating faithfully without ever taking a single day off. The very least we can do is pay closer attention to what we put into our bodies, because the next patient on my operating table does not have to be you. Thank you so much for watching. If this calm look at medication safety helped you or a loved one today, please subscribe to the channel, give this video a like, and share it with a friend or family member who uses a daily pill organizer. That simple share could protect a life. Please remember that everything I have shared today is general educational information based on clinical research. Every individual is unique. Before making any changes to your daily routine or medications, please have a full, open conversation with your own doctor or pharmacist. They know your personal medical history, and that personal context is exactly where good medicine begins. Take care of yourselves, and I will see you in the next video.